Since Friday, May the 1st, we have seen a 21% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 2,609 cases, 423 people hospitalized with COVID-19, and 120 deaths. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. Over the last month, we have stood up a new call center staffed by healthcare professionals to provide residents with the most up-to-date and accurate information. We have also launched an expanded dashboard which provides residents with essential information around this pandemic, including racial, gender, and age demographics, as well as testing site information and food access information. The new page also features a live chat option, providing residents with another avenue to get verified COVID information. We rolled out a broad-reaching advertising campaign. We've also launched the COVID-19 Small Business Assistance Initiative and the COVID-19 Small Business Task Force, which represent the first steps of many in Baltimore's continued recovery and eventually reopening. We have also launched 3 testing sites in the city: Pimlico, the Rollin Conservatory at Drew Hill Park, and Lake Clifton Park. All this in an effort to provide residents with the needed resources and to help keep them informed as we progress through this public health emergency. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptoms, screening, and be connected to a physician for assessment. Today, we are excited to announce a new initiative developed through our public-private partnership, TRI support, that will provide triage and isolation service to individuals with moderate or mild COVID-19 symptoms who are unable to self-isolate where they live and do not require hospitalization. This includes residents who live in multi-generational household, congregate living settings, individuals who experience homelessness, and the housing insecure. We will be accepting referrals from hospital and medical partners. Dr. Santa was unable to join us today, but I want to sincerely thank the University of Maryland Medical System for their partnership in this venture. I also want to highlight that our teams have collaborated on a robust clinical model for this site, which includes both residents and clinical support, and our health commissioner will talk more about that. I also want to thank the Lord Baltimore Hotel for their partnership in this important work. They have opened their doors to help vulnerable residents and reduce the spread of COVID-19. The TRI support initiative is a significant step in our continued work to reduce the spread of COVID-19. By accepting referrals from hospitals for people who, due to their living situation, may have difficulty self-isolating, this partnership will reduce the number of interactions amongst residents who have tested positive and reduce the spread of COVID-19. I know I probably sound like a broken record, and I know I do, because I keep saying the same message every week, but it's that important. We need everyone to stay home unless you need to go out for essential reasons. If you must go out for an essential reason, everyone should be wearing a face covering. This covering isn't for you. It is to protect everyone you come into contact with. It symbolizes that you care about your fellow residents. And I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. You have literally saved lives. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can save lives. Now I will ask Baltimore City Health Commissioner Letitia Zavasa to update you on our COVID response and our work to support the residents of Baltimore.
Good afternoon. Thank you, Mayor Young, and thank you to our partners for their continued support during the COVID-19 pandemic. I want to particularly highlight a partnership we've recently formed with the Lord Baltimore Hotel and the University of Maryland Medical System entitled the TRI Support Initiative, Triage, Respite, and Isolation. This is a significant step in our continued work to reduce the spread of COVID-19. By accepting referrals from hospitals for people who, due to their living situations, may have difficulty self-isolating, this partnership will reduce the number of interactions among residents who have tested positive with those who are negative. Individuals with mild or moderate symptoms who do not require hospitalization and need a place to be able to self-isolate safely will be referred to the Lord Baltimore Hotel by hospitals, healthcare providers, and the City Health Department. This includes individuals who live in multi-generational households, members of the immigrant community, people experiencing homelessness, frontline workers who wish to reduce the risk of transmission at home, and others who live in congregate settings or living situations that make it difficult to self-isolate. Through this partnership, the hotel will be staffed with resident and clinical support staff. Meals and cleaning services will also be provided. This is an important city resource that will be available for the coming months as we continue to respond to the COVID-19 pandemic. As the weather begins to warm, we acknowledge that it will be increasingly difficult for residents to abide by the stay-at-home order. Just this past weekend, we've seen a number of house party and cookout invitations go out on social media. I'd like to take a moment to remind residents that if you are inviting friends and family over for a cookout, a graduation ceremony, Cinco de Mayo party, or Mother's Day brunch, you're putting yourself, your friends, your family, and your neighbors at risk of getting sick. Please, in order to keep yourself and your loved ones safe, do not go out unless it is for an essential reason. If you are celebrating, consider connecting with your friends and family virtually. If you're going outside to get some fresh air, get some exercise, or walk the dog, please remember to abide by social distancing measures and wear face cloth covering over your nose and your mouth. Thank you.
Thank you, Dr. Zavas. So now we will take a few questions.
The Lord Baltimore Initiative. So those populations are coming from homeless shelters. I mean, if you can give us an idea of where they're coming from.
They can come from the hospital or other healthcare partners. Again, as well, the health department may be working with congregate living settings and identify individuals who would be eligible for the Lord Baltimore Hotel.
And these are folks who don't have to be hospitalized per se.
Correct. They don't have to be hospitalized. Again, this is not a hospital. It's a lower level of care. So it's people who can't self-isolate and are experiencing mild symptoms of COVID.
The story out of Prince George's County is that the Laurel Ice Rink has now been turned into a temporary morgue. Is there any consideration going on in the city of Baltimore for using some facility? Apparently the Office of the Chief Medical Examiner is having difficulty with enough capacity. Has that conversation been going on in the city of Baltimore?
Yeah, I was going to say OEM is probably better.
Okay.
But we're hoping we don't have to come to that.
Chief Savella with OEM. Yeah, we've been in some discussions and we have identified some locations that if we get to that point, we will be able to set something up along those lines. So yes, it is something that we've been considering and it is in our plans.
At this point, I mean, what's the likelihood that we would get to that point?
As far as I know right now, it doesn't look like we're going to get there, but we are preparing for anything that could come along down the road so that if it does happen, and hopefully this will not, we're prepared for it. Thank you.
Thank you.
Can we get one more? Mayor? Mayor, the top two people at the helm of your homeless initiative are currently not at work. One is on leave, one has quit. What is your plan to continue care for the city's homeless while you don't have anybody at the helm of that group?
We have a contingency plan. Cheryl, would you come up and talk about that? Because we're going to always take care of our homeless population no matter what.
So Tisha Edwards, who runs our Office of Children and Family Success, and I are going to be supervising the Mayor's Office of Homeless Services. We are bringing on a consultant who has subject matter expertise, who will be managing the day-to-day operations as well as doing an organizational and staff assessment and making recommendations to Ms. Edwards, me, and the mayor about next steps for the agency. But we are 100% committed to making sure that the level of care is provided and that we're providing the highest level of service to our homeless population. Well, again, Ms. Edwards is on leave, and John Turner is no longer with the city. Oh, sorry.
Any other question?
Mayor, with dozens of states starting phased reopen
Who
and
am I talking to?
What's that?
Who am I talking to? Okay, because I can see.
With dozens of states starting phased reopen and a grassroots root push by citizens here to reopen the state, what's your response to them? Is it time?
Well, we're going to do like I've always said. We're going to follow the advice of our healthcare professionals so that we can slow the curve of COVID-19. So what I want to do is make sure that the citizens of Baltimore are safe, and we're going to follow the guidelines from our health professionals. Thank you.